Imagine this. You walk into a hospital and a voice, not a person, greets you by name. It already knows your vitals, your symptoms, your last visit, and even your stress levels from the way you speak. This isn't science fiction anymore. This is healthcare in the age of artificial intelligence. Hi, I'm Imani, your AI career coach. My mission is to help you rise above the noise, stand out above the rest, and thrive in the AI era. And today, we're talking about something deeply personal: how AI is transforming the way we care for people, the way we diagnose illness, and the roles that keep our hospitals, clinics, and labs running every day. Because AI isn't replacing compassion, it's magnifying it. It's removing the repetition so that nurses, doctors, and technicians can do what humans do best: listen, connect, and heal. But here's the truth: many healthcare workers don't even realize the change has already begun. AI isn't coming, it's already in the hospital with you. It's in the X-ray scanner, identifying fractures faster than the human eye. It's in your patient's chart, predicting risks before symptoms appear. It's even in the voice assistants that take notes during consultations, so clinicians can look patients in the eye instead of at a keyboard. Let's talk about how this shift feels. For many in healthcare, AI brings both excitement and anxiety. Excitement because we finally have tools that can eliminate burnout. Anxiety because it challenges traditional job roles that have existed for decades. But just like every medical revolution before, from antibiotics to robotic surgery, the professionals who learn early will lead the next generation of care. Here's something powerful to remember: AI doesn't remove the healer, it refocuses the healer. It lets you spend more time with patients and less time on paperwork. It lets you treat earlier, respond faster, and prevent instead of just repairing. Now, let's look at how this technology is already reshaping the field. In radiology, AI systems like Google's DeepMind are reading scans with 94% accuracy, detecting breast cancer years before it's visible to doctors. In cardiology, AI algorithms can predict heart failure simply by analyzing an ECG. In nursing, automated charting and AI-powered scheduling tools are freeing hours every week. In pathology, digital microscopes with AI vision detect cell anomalies in seconds instead of hours. And here's a fun fact: some hospitals now use digital twins of the human body. That means a virtual replica of you, your organs, your blood flow, your medical history, is created to test treatments before they ever reach your body. Doctors can simulate surgeries, test medication responses, and prevent complications before they occur. That's not the future. That's 2025. Another fun fact: AI is now being used to translate medical instructions in real time into over 70 languages for patients around the world. Imagine a nurse in Tennessee helping a patient in Thailand instantly understood. That's not a dream. That's connection powered by code. But with every breakthrough comes a question: where do humans fit? Let me be clear: healthcare will always need humans. AI can calculate, but it cannot comfort. It can diagnose, but it cannot decide with empathy. The warmth of a reassuring hand or the trust built from eye contact can't be coded. That's where your strength still lives. What's changing are the expectations. Tomorrow's medical professionals will need to understand how to interpret AI results, question its data, and guide its outcomes responsibly. You won't just treat patients, you'll manage relationships between people and algorithms. Your badge may still say nurse, technologist, or physician, but your role will quietly evolve into something more, something hybrid. You'll become a translator between humanity and intelligence. Here's a glimpse at what that looks like. AI clinical analyst, someone who reviews data from wearable devices and translates it into care plans. Virtual health coordinator, professionals who use AI dashboards to monitor patients remotely. Robotic surgery technician, a new class of assistant who ensures surgical robots operate safely and ethically. Predictive care specialist, experts who use machine learning to prevent disease, not just treat it. And health data ethicist, professionals who protect patient privacy and prevent bias in AI-driven decisions. These are real emerging titles. And here's what's beautiful. They don't eliminate traditional roles. They expand them. AI won't take your purpose. It will extend it. The nurse becomes the navigator. The technician becomes the translator. The physician becomes the strategist. And the patient becomes the participant. Now, let's talk about the heart of it all, patient care. AI isn't just automating medicine, it's personalizing it. Every heartbeat, every lab result, every note from a wearable device feeds into systems that can alert your doctor before you even feel sick. It's like having a guardian watching your health quietly, around the clock. In hospitals using predictive analytics, sepsis and stroke survival rates are already improving by over 20%. That's not about replacing people. That's about protecting lives. Now, some people fear that AI will make care cold and robotic, but studies show the opposite. When clinicians spend less time typing and more time talking, patient satisfaction increases dramatically. AI is bringing empathy back to the bedside. It's helping humanity rediscover the human part of healthcare. Still, this shift comes with responsibility. We have to train the next generation of professionals, not just to use AI, but to question it, guide it, and protect ethical standards. That's why medical schools and certification programs are changing. You'll soon see new tracks for AI-enabled medicine, digital nursing, and healthcare data leadership. Whether you're in administration, diagnostics, or patient support, AI will touch your workflow. And if you're listening to this right now thinking, I'm not ready, take a breath. No one was ready for the stethoscope either when it first arrived. Adaptation isn't about knowing everything. It's about being willing to learn something new. Every breakthrough in history started with uncertainty and courage. So here's what I want you to remember. No, AI is not stealing your career. It's rewriting your capacity. It's amplifying your ability to heal, to understand, to decide, and to lead. It's transforming medicine from reactive to proactive, from isolated to integrated, from exhausting to empowering. And here's a question I'll leave you with. If AI can now predict, assist, and prevent, what will that free you to do? How will you use that time, that energy, that creative space to bring compassion back to medicine? Because the future of healthcare won't be built by machines. It will be built by humans who learned how to partner with them. So if you're a nurse, a medical assistant, a radiologist, or even a student just starting out, lean in. Learn the language of AI now, and you won't just survive the shift, you'll define it. Because the future needs you. And it needs you to be confident, curious, and connected. Give this video a thumbs up if it gave you clarity. Share it with someone in healthcare who might need this reminder that the heart of medicine still beats, and it beats human. And don't forget to subscribe for tomorrow's episode, where we'll uncover the top 5 AI-powered healthcare careers of 2030, the certifications that lead to them, and the new salaries shaping the medtech revolution. I'll see you tomorrow.